Leslie pointed out, this is what it does look like outside. So I was just pointing this out because the fact that all of you guys are here right now and it looks like that outside says something about us, and it says that we're probably nuts. Well, and I'm nuts too, and in fact, I'm dressed up in a suit and I'm up here and it looks like this outside. But the reason we're up here is because we have this medical LLSA thing that we're doing now. And it's important that we pass it because we want to continue our board certification and whatnot. And so I'm here. My name's James Rhee. I'm from Chicago. It doesn't look like outside like this in Chicago. So it's even worse that I'm here and I'm still inside. The study I'm going to look at, and what we're reviewing for this segment, is dopamine agonists and the risk of cardiac valve regurgitation. It's by a group from Germany. And it's actually very important for our practice, and it's something that we should be aware of. I know Brian is going to do a little bit of a review on valve disorders, another kind of paper that we need to review for this LLSA. Now, to give you a little bit of background, in the United States, in our population over 60, 1% they have Parkinson's disease. And this was well illustrated by Dr. Schonberg yesterday with a lot of video illustrations. And 1% is a significant number. That's a large number of patients who are going to develop this disease. And we don't really have a great definitive treatment for it. We have a lot of different drugs that we kind of throw at these patients, and we talked about carbidopa yesterday. But we're still kind of searching for something good. Now, dopamine agonists kind of fall into this armamentarium of the drugs that we can use for Parkinson's disease. And the dopamine agonists that we're kind of familiar with are bromocriptine. I'm not familiar with a lot of these other drugs. Ropinirole, you guys familiar with that? That's Requip. These other ones I'm not as familiar with. Pexol, Lisuride, Pergolide, Cabergoline. Now, out of these dopamine agonists, there have been case reports that have seemed to implicate Cabergoline and Pergolide as drugs that can cause structural valvular heart disease. And the investigators feel that part of it could be related to the fact that they're ergot derivatives, and we know ergots have their own toxicity related to them, but they also have agonism at the 5-HT2B receptor. And we know those receptors are also expressed on your cardiac valves. So they posed a very interesting research question that came out from these case reports. Do dopamine agonists, and specifically cabergoline and pergolide, increase the risk for newly diagnosed cardiac valve regurgitation? And the way they did the study is they designed a nested case control study. And when you have a nested case control study, that means it's nested in a bigger cohort. And the cohort they use is a large one, a very reputable one. It's the UK General Practice Research Database. Now, this research database has over 6.3 million patients in there. And it encompasses over 350 general practices. So it's a very large, robust database. And hopefully with Toxic, and I don't know if Paul is here, but with Toxic, hopefully we can generate a robust database in that regard too, and then we can do a bunch of cool studies. Now, from this database, they isolated a study cohort. They identified patients between the ages of 40 and 80 who had at least 2 prescriptions for anti-Parkinsonian medications. So when they kind of dissected this group out and took care of some exclusion criteria, they narrowed it down to 11,470 patients in the study cohort. Out of this cohort, they identified 31 cases of newly diagnosed cardiac valvular disease that with an unclear etiology. They also identified 663 controls, and these were matched for age, gender, and duration of treatment. So what did they find? Well, these are kind of the results, and they looked at all these dopaminergic agents, these agonists, and they found that, so in the very top line, there was these patients who developed valvular disease had no current or recent use of a dopamine agonist. So they used that as kind of the baseline. And in the cases, there were 6 cabergoline cases and 6 pergolide cases. And when they used, and then they had also 34 cases in the controls, 26 for pergolide in the controls as well. And when they used an adjusted incidence rate ratio, they had an incidence rate ratio of 4.9 for cabergoline and 7.1 for pergolide. which is very interesting. And it kind of is consistent with what they were expecting to find. They dissected it down even further, and they looked at the dose that was given to these patients. Now, here they broke it down, so pergolide into less than 3 and greater than 3, comparatively less than 3, greater than 3 per day. And they noted that there was a bit of a dose-response effect here as well. Those who had pergolide doses of greater than 3 milligrams per day, there was an increased incidence of valvular heart disease. Same was found for cabergoline. Now, duration of treatment also has an effect as well. All these cases occurred basically in cases of patients who were on these drugs for over 6 months. So we're not talking about short-term exposure, we're talking about a longer-term exposure. I summarized kind of the key findings here. So just based on current use, adjusted incidence rate ratio was 7.1 for pergolide, 4.9 for cabergoline, and if it was greater than 3 milligrams, it bumped up to 37.1 for pergolide, 15.3. I mean, those are big numbers, even in my mind. And then if they were on it for greater than 6 months, 9.8, 7.8. So the conclusion, and I think we all kind of come to the same conclusion, is that the use of pergolide or cabergoline is associated with an increased risk of newly diagnosed cardiac valve regurgitation. And that this risk is increased with higher doses and actually as a prerequisite, prolonged duration of treatment. So of note is also that none of these other isuride or pinerol, pramipexole, and bromocriptine were implicated as causing valvular heart disease in this study. There were some limitations to the study, but you'll find that there are other studies that actually confirm the findings of this study as well, which lend its strength. And with that, I will go back to our slide.